Good evening. Welcome to this edition of the 411 Talk Zone radio show. My name is Leon Jones. Tonight's topic, we'll talk about dependent personality disorder as a mental illness. Now, a dependent personality disorder is basically characterized by a long-standing need for the person to be taken care of and a fear of being abandoned or separated from important individuals in his or her life. This leads the person to engage in dependent and submissive behaviors that are designed to elicit caregiving behaviors in others. The dependent behavior may be seen as being clingy or clinging on to others because the person fears that they cannot live their lives without the helps of others. Now, when I say the helps of other, I'm talking about the helps of other people. Now, individuals with dependent personality disorder often are characterized by pessimism and self-doubt, and they belittle their abilities and assets and may consider themselves or refer to themselves as stupid or ignorant. They take criticism and disapproval as proof of their worthiness, and they lose faith in themselves. They may seek overprotection and dominance from others. Occupational functioning may be impaired if the dependent initiative is required. They may avoid positions of responsibility and become anxious when faced with having to make decisions. Social relations tend to be limited to those people on whom the individual is dependent upon. Now, chronic physical illness or separation anxiety disorder, which I'm going to talk about in my next video, in childhood or adolescence may predispose an individual to the development of DPP, and I'm talking about the dependent personality disorder. A person who has a personality disorder such as DPP, they basically have an enduring pattern of inner experience and behavior that deviates from the norm of the individual's culture. The pattern is seen in two or more of the following areas: cognition, affect, interpersonal functioning, or impulse control. The enduring pattern is inflexible and pervasive across a broad range of personal and social situations. It typically leads to significant distress or impairment in social, work, or other areas of functioning. The pattern is stable, of long duration, and its onset can be traced back to early adulthood or adolescence. Now, of course, with any mental disorder, one must understand that they are different symptoms. Now, when it comes to DPP, and I'm talking about dependent personality disorder, of course, I've already told you that it's characterized by having a clinging behavior. And, that sounds very, very familiar. And this is why you have so many children who continue to live at home. I bet you a number of them have this type of disorder. Because I realized when I was reading internet dating ads, a number of women and children, and I'm talking about grown children, were living at home and the children refused to leave. Now, my gut feeling says that, okay, some of the children may not be able to make it because it is very difficult, but you have a number of them who can't make it on their own simply because they have this disorder. The children don't know it, and the mother doesn't know it. Because when somebody has DPP or dependent personality disorder, they have a difficulty of making everyday decisions with an excessive amount of advice and reassurance from others. They also need others to assume responsibility for most major areas of their lives. They also have difficulty expressing disagreement with others because of the fear of abandonment or loss of support and approval. Now, we're also looking at that area of insecurity. They have difficulty initiating projects or doing things on their own because of their lack of self confidence in judgment or abilities rather than a lack of motivation or energy. They also go to excessive lengths to obtain nutrients and support from others to the point of volunteering to do things that are very unpleasant. They feel uncomfortable or helpless when alone because of exaggerated fears of being unable to care for themselves. Also, they urgently seek another relationship as a source of care and support when a close relationship ends. And they're also basically unrealistically preoccupied with fears of being left to take care of themselves. Because DPP, again, DPP stands for personality or dependent personality disorder. So, because personality disorders describe long standing and enduring patterns of behavior, they are most often diagnosed in adulthood. It is uncommon for them to be diagnosed in childhood or adolescence because a child or teen is under constant development, personality changes, and maturation. However, if it is diagnosed in a child or teen, the features must have been present for at least 1 year. Dependent personality disorder is diagnosed in between 0.5 and 0.6% of the general population. Like most personality disorders, dependent personality disorder typically will decrease in intensity with age, with many people experiencing few of the most extreme symptoms by the time they reach their 40s and 50s. Now, how is it diagnosed? Well, personality disorders such as dependent personality disorder are typically diagnosed by a trained mental health professional such as a psychologist or psychiatrist. Family physicians and general practitioners are generally not trained or well equipped to make the type of psychological diagnosis. So while a person can, and that person is you can initially consult a family physician about the problem. The person should refer you, and I'm talking about the family physician. They should refer you as the individual to a mental health professional for diagnosis and treatment. There are no laboratory, blood, or genetic tests that are used to diagnose DPP, dependent personality disorder. So many people with dependent personality disorder basically don't seek out treatment. People with personality disorders in general do not seek treatment until the disorder starts to immediately interfere or otherwise impact a person's life. The most often happens when a person's coping resources are stretched too thin to deal with stress or other life's events. A diagnosis of DPP is made by a mental health professional comparing your symptoms and life histories with those that I have told you about. And I'm talking about someone who is urgently seeking another relationship and being alone because they feel helpless because in their mind they cannot make it on their own. So, when it comes to professionals, mental health professionals, they will make a determination whether your symptoms meet the criteria necessary for a personality disorder diagnosis. Now, of course, researchers today don't know the causes of dependent personality disorder. There are many theories, however, about the most possible causes of dependent personality disorder. Most professionals subscribe to a biopsychosocial model of causation. That is, the causes are likely due to biological and genetic factors, social factors, such as how a person interacts in their early development with their family and friends and other children, and psychological factors. I'm talking about the individual's personality and temperament shaped by their environment and learn coping skills on how to best deal with stress. This suggests that no single factor is responsible, rather than it is complex and likely intertwined nature of all three factors that are important. So if a person has the personality disorder, research suggests that there is an increased risk for the disorder to be passed down to their children. And as with every disorder, treatment of dependent personality disorder typically involves long-term psychotherapy with a therapist that has experience in treating this kind of personality disorder. Medications may also be prescribed to help specific troubling and debilitating symptoms. Well, that being said, going back over what I've just discussed, all mental disorders are going to require some form of help. A family physician is not going to be the answer, but you can contact your family physician. They have the networking ability to find a specialist who can best help you with this disorder. And this is a serious disorder because, I look at it now and I'm just making an overall generalization, and a generalization is generally true. But this is why I see a lot of these families, particularly the grown kids, still living at home. Now, again, I'm going to go ahead and review it, so please, if you come to my channel, please don't be emotional about what I'm going to say, because it must be said. A number of these families have DPP. It seems to be a big factor in society because if you look at this generation of children, they can't function by themselves. And some of these moms, when their children leave, you ever heard of empty nest syndrome? Well, they get empty nest syndrome because the children and the mom, and I'm saying mom because most of the children basically who are grown and they bring their grandchildren in to live with them as well, and they pack the whole house like roaches, and they depend on each other for their nurturing, their financial stability, and of course their love. And if you look at it, there's generations. It's usually the mom, the daughter, the grandchildren, and you might even have some of the boys, but it's mostly, I see a lot of females who have a group or a gang of kids, grown kids, living with them at home. Now, to some effect, it is very hard in this economy, so I can give that a pass. But that should be a temporary stay. But it's not temporary. For the most part, I see a lot of this. And I didn't start seeing it until I moved to Pennsylvania. And it's gotten worse now. Now, it started, from my experience, with a lot of white women doing it. Now, in the latter years, the black and Hispanic women have caught up. Now, I'm not saying that it's a bad thing, but when your children and you as a person can't function without each other, in other words, the children aren't going on to have stable relationships, and sometimes the mom is not going on to have a stable relationship. Now, there are other factors that are involved with that as well, but this is where families are dependent on each other, because if they didn't, they have it in their mind that they wouldn't survive without each other. You can survive. It's something that you have to want to do. You got to take the risk, because at the end of the day, for your children who are living at home and your moms are still taking care of you, Better get a grip and grow up, because mom isn't going to be there or dad is not going to be there to continue to take care of you. I know some people are going to ask me, well, what does that have to do? It has a lot to do, because you get some children who are focused and you get some parents who can't do without their children. It's a fact. And you get the children who are in the same type of predicament. Go to college and they come back home. Because I see where that case is developing. Now you also have somebody who is very clingy. And that could be from a situation of being abandoned in the past, and there's a level of insecurity issues that are combined. You see, with all of these mental disorders, they're intertwined, they're connected. Because what do you get with abandonment? You can get depression, you can get anxieties such as eating anxieties, you can get stress anxieties, you can get high blood pressure, diabetes. The list goes on and on and on again. So the best way to treat any disorder is, number one, seek help. And once you seek help, follow the program. Because the more education you have, the better it is going to be for you. And admit that you have a problem, because there are a number of people who have this disorder because there's no research. They believe that they don't have to seek any help. Well, that's a problem when you don't seek help, because you're really hurting yourself and others. And the way your family is going to deal with you, society is not going to deal with you in the same predicament. They're not. They're not going to feel as sympathetic for you. So, by all means, if anybody out there has dependent personality disorder, seek out some psychotherapy and counseling. And if you have to take medication, which I'm truly against medication, because, again, we thrive on medication because we're addicted to it. And all medication does is relieve the symptoms temporarily. And once the medicine's gone, we have to go get new medicine. That's what keeps us depending on the medicine. It's already ingrained in our head that we can't do without the drugs in our system. We can. Try holistic healing, exercising, eating a balanced diet. Also, before that, and I'm talking about diets, meditation, get some help from a psychologist. They're trained to understand the mind and the characteristics of behavior that go with the mind, because everything is mental. And again, if you have a strong mind, you will evolve. If your mind is not strong, you're going to continue to have problems. So my idea, drop the pride. Admit you got a dependent personality disorder. Seek help and commit to that help. That's the biggest thing. Because in the long run, you can take a horse to the well, but you can't make him drink. So it's on that individual. They want to get help. The resources are there. The only thing you have to do is take a risk. And that risk is being smart by allowing yourself to be helped. Because at the end of the day, you don't want to be another lost victim who's going to end up committing suicide, which that's hurting yourself or other people. Because you get one life. Once it's gone, there's no coming back. So remember, you have a problem, please seek help, because it's going to benefit you and the rest of society. And that's my commentary for this edition of the 401 Talk Zone radio show for this evening, Monday, May 22nd, 2017. You can tune into the 401 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. Guest call-in number is 215-383-5785. Of course, if you like my videos, please share and subscribe to the 401 Talk Zone radio show right here on YouTube so I can continue to give you quality information for educational purposes from a professional and mature perspective. Now, on my channel, I don't engage in debates, controversy, nor do I do emotional issues for the most part. Now, if there's one or two that seem emotional, I'm trying to break down the topic so you'll understand the education component, because my job is not to offend, my job is to teach. Because on this channel, I don't engage in drama or unnecessary bickering because it is counterproductive. Of course, this channel is for educational purposes. I'm giving you an overview of the topics that not too many people talk about, and mental issues. That's really the root cause of a lot of people's problems in the United States, but we don't want to talk about them because we're afraid that we will offend people. And of course, this channel is not politically correct. So education and truth, they do hurt. But once you get to the root of the problem, it'll help you understand what's going on with your life and how the real world works. Because the information that I provide is very positive, but realistic. And if you don't know how to survive in the real world, you're going to struggle. And you're going to end up with DPP, dependent personality disorder. And you're going to have that fear of abandonment. You're going to be living home with your parents for the rest of your life. And of course, some of the parents, they're going to want you to live home with them as well because they also have DPP. Because if you're a child and you're motivated and you want to move out, they're going to have empty nest syndrome. So they're not going to understand how to survive. And some of you parents need this knowledge that I'm giving as well. Because we got too many families who are living together. And I believe a number of families have DPP. I do believe it. If you don't believe me, look at the statistics out there. There are more and more families. And I'm not talking about cultured families like Mexicans. I'm talking about average American people. Now, of course, the economy is bad, but children should learn how to grow up and move out on their own. And parents should understand that children are loaned to you by God. The reason why you keep a hold of your children because you don't want that empty nest syndrome and you don't believe in God, because we're all God's children. Let your children go and let God handle them, because God knows what place and what journey he wants to take the children that he lynched. That's right. You remember on this channel, it's positive because knowledge is power. If you have a business, a topic, or a new YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. And if you have a comment, please leave your comment under the comments section. And the comments will leave it in the comment section under the video. But make sure that your comments are pithy. No bloviating, pettifogging, or filibustering. If you wish to opine. Now that's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other, and have a wonderful and blessed evening. Good night.